Your provider has ordered the Doctor's Data Heavy Metal Urine Collection Kit. You'll see the supplies of the kit contents outlined here. There will be 2 kits that your provider will release to you. One will be the pre-medication and one will be the post-medication. We'll start off by just looking at these requisitions here. You'll notice that your patient information will be outlined here. We'll have this information filled out by our front office. But what you will need to put down here is the date that sample was collected, making sure that that height and that weight information is completed. You will select the less than 24 hours, and it will be 6 hours that you will do this one for. And then selecting either the pre or the post. If you're going to, you need to kind of, one will be pre, one will be post. You can pick which one you want to do that for. And the provoking agent we will make sure to fill out, but it will be a drug called DMSA, and we will put the dosing here. Nothing else needs to be completed in this portion here, just making sure that your information is correct. And if we are billing the physician's account, so we don't need to put any of the credit card information on there. There is a spot for you to sign here as well as date, so make sure that that is completed. On the backhand portion of things, don't pay attention to any of this. This is for other offices that utilize that portion of this test kit. What you will do is on the day that you decide to do this collection, you'll wake up first thing in the morning and urinate into one of these containers here. You can aim for a really halfway mark, that would be just fine. And then you'll take this little biohazard bag that has this tube with the red cap on it and dump the urine from this container into this one, not filling over that black line. Once that has been completed, you'll twist on this cap nice and tight, making sure that it's not leaking anywhere. Put your name, the date that you collected it, and your date of birth, and note if this is going to be the pre one, that the pre one means that you haven't taken any medication and you're transferring the urine directly from this container into this tube. You will mark the pre, making sure everything's labeled, twisted on nice and tight. You'll put this container into this biohazard bag once again, placing that little paper towel piece around it to catch any condensation or liquid that might leak out from it. And then you'll seal it just like a normal Ziploc bag and place into the refrigerator. After you've done collecting that very first morning urine, what you will do then is take the allotted dosing of that DMSA medication, which typically ranges between 5 and 9 tablets taken all at once on an empty stomach. And then what you will do after you have taken that medication is collect your urine for the next 6 hours in the orange container that's provided. Between each urination, you will put this into the refrigerator and then take back out when you're ready to urinate. You can open this little slot to make urinating into this container a little bit easier, or what you can do is use that other plastic cup that's included in your second test collection kit, urinate directly into here, and then dump into this container. At the end of that 6-hour time period, what you will do is shake up this container with that refrigerated urine to make sure that everything is distributed evenly. You'll take out the second tube that's here, opening up that biohazard bag, taking out this tube, opening up that cap, and then pouring either through this spout here, or if you decide to just unscrew that white piece and pour directly from there, no further than that black line there. You'll make sure that you're labeling with your name, the date that you collected it, your date of birth, and then this one would be the post, so you just put a little X or fill in that square to indicate that it's post. Then what you'll do, you can throw both of these little cups away. You can tighten this cap up and place it in that biohazard bag, putting it back into the refrigerator with the pre. And then what you're going to do is designate a box to ship out each sample. So let's say this is your pre-box. You'll put that pre-sample in here. So what you'll do is you'll place it just like so. Does not need to be shipped on ice. This requisition that's completed with all of this information that I mentioned prior is done. You'll fold it up nicely, place it into the box just like so, and close the box. Sometimes it's helpful for patients to label this as pre in this area here, and then you'll place it into the FedEx bag just like so, taking the sticker off and affixing to the front of that bag. You're welcome to put your return address if you'd like, and then you'll ship it out through FedEx. Same deal with the post. This is all labeled and marked as post. You'll place in here. This requisition will have that post marked just like so. Just like that. You'll close that box up. You're welcome to put post on here just to make things easier, and then place into the other FedEx bag that's included. And both you can ship out through FedEx. So in order to do so, you'll be contacting FedEx either to arrange for a pickup directly from your house, or you can arrange for yourself to drop it off at a FedEx location. Important to note, after you take the medication, please wait 1 hour before you eat anything. With this medication too, by taking different multivitamins and supplements, sometimes it can interfere with the absorptions of these multivitamins or supplements. If you are on any of these things, please contact your doctor to make sure that you are able to stay on them, or if you need to go off of them for the day of testing. If you have any questions, please don't hesitate to reach out to your provider.